1, I'll be performing a physical exam on you. Is that okay?
Okay.
I've already washed my hands and donned gloves for the purpose of this video, and I would have already done vital signs of the patients. Are you in any pain?
No.
Okay, so I'll begin by inspecting the patient's skull. I'm going to ask you to tilt your head forward. So the patient's head is round, normocephalic, atraumatic. His head is midline and symmetric. I'm looking at the side of the patient head. I'm also looking at the back of the patient's head, and I'm not seeing any bumps or lumps, no masses on the patient's head. The patient's hair appears thin on the sides, as well as the patient's hair color is black, and the hair is evenly distributed with some signs of pattern balding in the frontal area. The patient has normal facial hair. I'm going to palpate the patient's head. Let me know if you're feeling any tenderness. Are you feeling any tenderness?
No.
The patient's face is symmetric. His skin is intact. There's no rash, no lesions on the face, no acne, no discoloration, no facial abnormalities, no facial deformities that I can see. I'm looking at the patient's eyes. I can see that they're evenly distributed. There's no lesions, no discharge coming from the eyes. The eyes are centered and they're equally colored. The pupils, I'm going to pull down on your eyes a little bit. There's no yellowing of the eyes. Pupils are midline and equally sized. The patient's eyelashes and eyebrows are evenly distributed. No swelling, no lesions on the lids, no discharge. While looking at the patient's eyes, the conjunctiva and the sclera is clear, white, and moist. The iris is round. It's evenly colored. It's equal in size and centered bilaterally. The cornea itself is clear and transparent. Looking at the eyes, I can also see that the medial and the lateral cantuses of the eyes are without encrusting. Looking at the nose is midline. There's no drainage coming from the nose. It's proportionate to the face. The ears are equal in size, bilateral on the head. No drainage coming from the ear. Looking at the ear, I can see also that they're aligned with the outer canthus of the eye. I'm looking at the lips. The lips are smooth. There's no cracking of the lips. There's no lesions on the lips. And I'm looking at the patient's trachea, and there is no tracheal deviation. I'm gonna also palpate the sinuses for tenderness. Let me know if you're feeling any areas of tenderness. So I'm palpating the frontal sinuses. Is there any tenderness? I'm palpating the maxillary sinuses. Is there any tenderness?
No.
Okay, so I'll also palpate the temporal artery. I'm gonna place my fingers by the tragus of the ear. Bilaterally, the pulsation is about 2+, which is regular, and it is without any tenderness. I'm also gonna palpate the patient's mastoid process, where you're gonna let me know if you're feeling any tenderness as well. Is there any tenderness?
No.
I'm gonna have a look at the patient's lymph node. Let me know if you are feeling any tenderness. I'm gonna start by palpating the patient's preauricular area. Are you feeling any tenderness?
No.
I'm gonna palpate the postauricular area. Any tenderness?
No.
Septal area.
No.
Submandibular, the submental. Let me know if you're feeling tenderness.
No.
The superficial cervicular area, the post-cervicular area, and the supraclavicular area. Are you feeling any tenderness at all? So there's no enlargement or tenderness of the lymph node that I can feel. I'm going to ask you to tilt your head back a little bit. I'm going to observe the thyroid, where it is, by asking you to swallow. Okay, and as the patient swallow, I'm able to feel the thyroid without any mass, no nodules, no lymph node enlargement. I'll now test for visual acuity of the patient and in cranial nerve number 2, and I'm going to test using the Snellen chart. And I'm going to ask you to read the lowest line that you can read as I hold it here.
LTFPN.
I'm going to ask you to cover your left eye and read the lowest line that you can read.
LTLPH.
Okay, I'll cover the other eye and read the lowest line.
LTFPH.
Okay, patient is able to read on the Snellen chart at 20/20 vision. So I will now be testing the patient for visual field. I'm going to ask the patient to focus on my nose, cover your right eye, and I'll cover my left eye, and you tell me if you can see my fingers from where they are.
No.
Okay, so now you're going to tell me when you see my fingers, okay? You able to see my fingers now?
Yes.
Okay, I'm going to do the same thing on the other side, and you're going to tell me, are you able to see them now?
Yeah.
Okay, very good. We're going to switch eyes, and you're going to cover the other eye, and we're going to do the same. Tell me when you see my fingers.
Yeah.
Okay, very good. And we're going to try again, and you're going to tell me when you see my fingers. Can you see my fingers? But tell me when you're able to see my fingers.
Yes.
Okay, very good. That is the test for visual fields. Now I'm going to be checking for convergence. And I'm going to ask you to focus on the pen. And as I do that, I'm testing for convergence. I'm going to ask you to not move your head, but you're going to use your eyes to follow the pen, okay? So as I go, use your eyes to follow the pen, not your head. Okay, very good. Very good. Very good. Very good. Very good. Eyes and not your head. Very good. So this is me testing the patient's cranial nerves, the oculomotor, the trochlear, and the abducens cranial nerves. And his cranial nerves are intact, no nystagmus or strabismus. I'm going to ask you to look at a picture on the wall behind me. Looking at a picture on the wall behind me, then I'm going to ask you now to look at the pen.
Yeah.
Very good. Convergence is normal. His eyes dilate and contract. Raise your eyebrows. Very good. I'm going to ask you to close your eyelids tightly. And now I'm going to ask you to try to see if you can raise your eyebrows with it. Show me your teeth. Very good. Now I'm going to ask you to smile without teeth. Puff out your cheeks. The facial nerve is intact. All right, I'm going to move on to pupillar response. I'm going to be using my pen light. Shine the light in your eye. And I'm going to ask you to look off in the distance. So, okay, very good. And I'm going to do this on the other side. Very good. I'm going to do it again as I look in the opposite eye. Okay, and I'm going to do the other side. Okay, very good. Pupils are equally and bilaterally reactive to light, both directly and consensually. Also, to look at the structures of the patient's eyes. So I'm just turning the light on and assessing, and then I'm going to look at the patient's left eye. So I'm going to first find the red reflex. I'm going to move in to see the internal structures of the patient's eye. Very good. I'm going to do the same on the other side. Using my right eye, looking into the patient's right eye. I'm going to find that red reflex, and I'm going to move in when I locate that red reflex. And the optic disc margins are visible. There's no blurring of the margins, and I can also visualize the optic vessels. I will begin with the Weber's test, and I'll be using a 512 tuning fork for that purpose. You're going to tell me where do you hear it, okay? Where do you hear the sound?
In front.
Okay, that's normal because it's heard midline. I'll also be testing the Rhines test on the patient. So I'm going to place the tuning fork on the mastoid person. You're going to let me know when you no longer hear the sound, okay? No longer hear it. It's gone? Okay, and I'm going to be doing the same. You know when you no longer hear the sound.
It's gone.
Okay, the patient's hearing is normal without any sensory, neural, or conductive hearing loss. So I will do the whisper test, and which is testing for auditory acuity. You're going to let me know what word you hear I say.
Hallelujah.
Okay, and I'm going to do it on the opposite side, and you let me know what word you hear me say.
Preparation.
Okay, the patient is able to repeat what is heard. I will now examine the internal structures of the ear. And that one again, making sure that my light is working. So it's an adult male, so I'm going to pull the auricle up and back, and I am looking for the patient's tympanic membrane. I'm going to do it on the opposite side as well. Ear up and back. Good. So I can see that the auditory canal is pink and smooth. There's no obstructions, which means the auditory canal is patent. The tympanic membrane is pearly gray and it's intact. So there's no perforation or scarring to the tympanic membrane. I can see the cone of light at 5 o'clock in the patient's right ear and 7 o'clock in the patient's left ear. I'm going to ask you to close one nostril and breathe in. And I'm going to ask you to do that on the opposite side. Close the nostril and breathe in. Okay. And I'm going to ask you to tilt your head back as I hold the nose. Very good. I can see that the patient's nares bilaterally is patent. It is pink, moist, and there's no polyps in the patient's nasal area, and the nasal septum is straight. And I'll look at the patient's mouth, detecting the gums. So as I use the tongue depressor, I'm going to be moving around. I'm going to ask you to stick your tongue out a little bit. I can see that the patient's teeth is white, and the dentition is intact, and there's no signs of decay or loose tooth in the patient's mouth. The gum and mucosa is pink and it's moist, and there was no signs of bleeding in the patient's mouth. I'm going to ask you to open again to say ah.
Ah.
Okay, so the uvula is midline. The patient does have normal rise and fall, as well as I can see that the tonsil is symmetric. So that's test of cranium nerve number 9, glossopharyngeal, the hypoglossal, and the vagus nerves, which are intact. I'm now going to test the patient. Use a Q-tip, which I have the sharp side, which I'm going to remove the cotton from, and a dull side. So I'm going to let you feel. So this is what sharp feels like, and this is what dull feels like. So I'm going to ask you to close your eyes, and as I test, you let me know what your if it's sharp or dull. Okay? So
Dull.
this one,
Sharp.
okay, and this one,
Sharp.
about this.
Sharp.
Okay, very good. And the patient says he's feeling sharp, and I am using the sharp side. I'm going to test again. What are you feeling?
Soft.
Dull, sharp, or dull?
Dull.
Very good.
Dull. Dull.
This cranial nerve 5 is intact. So I'm going to put my arms on your face, and I'm going to ask you to turn from side to side against resistance. Very good. And I'm doing the same thing on the other side. Okay, I'm going to ask you to shrug your shoulders upwards against resistance. Very good. And this is me testing cranial nerve number 11, which is intact. The patient has full range of motion in his neck, no stiffness, and the strength is a 5 out of 5. I'm now going to do lung assessment on the patient. I'm going to first inspect oral mucosa just to look if there's any cyanosis, looking around the patient's mouth, and also looking at the eyes. I'm going to look at your fingers as well, and I'm looking for any cyanosis, and there's no signs of cyanosis. Capillary refill is less than 3. I'm looking at the patient, and his breathing effort is normal. I'm going to ask the patient to open his shirt a little bit so I can see his bare chest, so I can see that the patient has normal breathing effort. I would normally do check the respiratory rate, rise and fall of breath for a full minute. The clavicular areas are symmetric. The patient is breathing without any distress, regular rhythm and rate as I can visualize. There's no nasal flaring, there's no pursed lip breathing by the patient. I can see that the skin on the chest, anterior chest, is intact. There's no lesions, there's no masses. The nipple lines are symmetric. As the patient is breathing normally, I can see that chest movement is symmetric on both sides bilaterally. There's no intercostal retractions, there's no deviations or use of accessory muscles, as I can see that the anterior posterior diameter of the patient is normal within. Looking at the posterior spine, I can see that the patient's spine is midline. Looking at the patient's back as well, I can see that the shoulder blades are also symmetrical. There's no sign of lesions, bumps, or anything. There's no curvature of the spine. There's no indentations on the spine as well, and no protrusions. I'm going to palpate. Let me know if there's any tenderness as I palpate. In the chest area, I haven't feel any mass, no tenderness. The patient is not having any pain as I palpate the chest wall. There's no signs of crepitus. And I'm also going to palpate the posterior chest wall, not feeling any fremitus or anything. I'm going to ask you to take a deep breath in and out. And as the patient inhale and exhale, I can see that there was symmetrical expansion of the chest, and there was no costovertebral tenderness. First, I'll be auscultating anteriorly. Deep breath in and deep breath out. Okay, go ahead. Very good. On the other side. Good. Very good. In. Again. And out. Breathe in. And out. Okay, breathe in. And out. Breathe in. And out. Very good. And I'm going to do the same on the posterior side. I'm going to ask you to breathe in and out as I. And breathe in and out. Very good. In and out. Breathe in and out. Breathe in and out. Breathe in, out, in, out. Very good. In, out, in, out. And I'm also going to be listening to breath sounds on the lateral side. Breathe in and out. Breathe in and out. Very good. So I can hear vesicular sounds over all the lung fields.
Okay, so now I'll begin with abdominal examination, and I'll first ask the patient, is there any tenderness? I have the patient already covered. And is there any tenderness to your abdomen?
Yeah.
Okay. So I'm going to first begin with inspection of the patient's abdomen. I'm just making sure to keep the patient covered as much as possible. And upon inspection, we can see that the abdomen is flat. There's no protuberance. It is symmetrical. There's no signs of the patient guarding, and there's no protruding mass. The skin tone is appropriate to the patient's ethnicity. So I'm going to auscultate and listen to the patient's abdomen, and I'll be using the diaphragm. Okay. And I'm just listening to the patient's bowel sounds. And we can determine that the bowel sounds are normoactive and they're present in all quadrants. I'm now going to use the bell of my stethoscope, and I'm going to be listening to the patient's vasculature. And I'm going to first start with the aorta. And then after I listen to the aorta, I'm going to listen to the bilateral renal arteries. And I'm listening for signs of Breuil, which there are no signs of Breuil. I'm going to also listen to the iliac arteries and the femoral arteries. And now I'm going to listen to the patient's moral arteries, which are lower down. So after listening to the patient's arteries, there are no Breuils that are hurt. I'm going to now do the percussion of the abdomen, and I'm going to percuss in all quadrants. So I'm going to start in the left quadrant, and I'm going to be percussing. patient's left lower quadrant, the umbilicus, moving over to the right lower quadrant. And as we come down, bowel sounds, which the area move over any organs. We're hearing areas of dullness, but otherwise over the bowel, we're hearing areas of of resonance. And I also check for the patient's liver span, and liver is located on the patient's right upper quadrant. So I'm going to be checking for the patient's liver span in the right upper quadrant. And I'm going to percuss down from the nipple line until an area of dullness, from an area of tympany to an area of dullness. And I'm going to mark that area. And I'm going to percuss up, also listening for, which I'm going to be measuring. And that's about a measurement of 7, which is normal for a male. I'm now going to assess for splenomegaly, which the spleen is on the left upper quadrant, and I'm going to be percussing the spleen with just to feel for and over this area, because there's rib cage and stuff. You're hearing areas of dullness. Now I'm going to be moving on to palpation, and I'm going to be palpating starting from the patient's left upper quadrant. And as I palpate, I'm going in a circular motion from light to medium to deep, and just let me know if you're feeling any areas of tenderness. Are you feeling any areas of tenderness?
Yeah.
Okay. And I'm just palpating, coming around, and I'm palpating. The patient is not experiencing any grimacing of the face, and the patient is not showing any signs of guarding. So I can feel no distension in the suprapubic area of the patient. Now I'm going to be palpating for the patient's liver, which is on the right upper quadrant. Normally I put my hand under the patient, my left hand, and I'll ask the patient to take a deep breath in and out. Very good. All right. And I'm also going to be palpating the spleen, which is on the patient's left quadrant, and the same thing I'll be feeling and asking you to take a deep breath in and out. And the spleen, normally you'll be unable to palpate the spleen. Generally you'll be unable to palpate the spleen. I'm going to ask the patient now to sit up for me as I assess for any costrovertebral tenderness in the area of the kidneys. I'm going to just be, and you let me know if you feel any tenderness. Any areas of tenderness?
No.
And we do that for both sides. Thank you. Okay, and we're going to be testing for some special tests, which the first is going to be just testing for any gallbladder irritation that the patient may have. And by doing so, I'm going to be kind of cupping the liver, which is kind of the Murphy's sign. So I'm going to ask you to lay back again. Just watch your head as you lay back. And again, we're going to just ask you to take a deep breath in, and then out. And we're just feeling for the margins of the liver. And normally, with the Murphy sign, if the patient inhales, and if there's cessation in the inhalation, it means that there's a positive Murphy sign. Now I'm going to be testing for Barney's point, and I'm going to be pressing in that area. And if there's areas of tenderness, then the patient will let me know. So from the iliac to the umbilicus, 2/3 of the way down, I'm going to apply pressure. You let me know if there's any tenderness.
No.
So there's no feeling of no presence of appendicitis. I'm also going to be just checking the patient for Rossing sign, which I'll be palpating just to see if there's any rebound tenderness on the opposite side of the patient. So I'll be palpating on the left, and you let me know if you're feeling any pain on the right. Okay. So as I palpate on the left, the patient doesn't show any signs of pain on the right side, so there's no rebound to the right side, so there's no positive Rossing sign. Okay, we're going to now move on and move to test the patient for the fluid wave test, which I'm going to ask the patient hand. Turn your hand this way, yes, that way, and the other hand this way, right? and I'm gonna place my hand on this side, but I'm gonna tap this side, and if I feel any shift in fluid on that side, that is a positive wave test. So I haven't felt any shift in fluid when I tapped on the patient's side, which means that the patient does not have any signs of ascites. I'm gonna move on now to our musculoskeletal test. Just sit up for this test at this time. Thank you. I'm gonna ask you to face the camera. Sorry. And I'm just gonna take the sheet away. You're in. All right. So I'm gonna first look at the patient's head, and I can see that everything is normocephalic. His head is round. There's no there's symmetry of the head to the shoulders. I'm looking at the patient, and I don't see any protrusions on his head or anywhere there. And I'm gonna ask the patient to just clench your teeth, open your mouth, and close. Okay. And I'm just testing transmandibular joint of the patient to see if there's any crepitus, and there's no crepitus. There was no pain, there was no grimace in the patient's face. I'm now going to assess the patient for range of motion. So I'm going to ask you to first put your chin to your chest. Very good. And then I'm going to ask you to point your chin towards the ceiling. Then I'm going to ask you to lift your, turn your head towards your right shoulder, and then turn your head towards your left shoulder. And then I'm gonna ask you to use your head, to use your ear to try to touch your shoulder. And try to do that on the other side. Very good. And we see that the patient has full range of motion and full muscle strength in his neck, which is like a 5 to 5. I'm gonna ask you to shrug your shoulders up. Very good. And down. Very good. So the patient has 5 to 5, a grade 5 level strength. Now I'm gonna inspect the patient's upper extremities, and I'm gonna take a look at your arms. I'm gonna ask you to place your arms out, and I'm inspecting his arms for any swelling, if there's any discoloration in the arm, if there's any cyanosis of the nails. I'm looking at the nail beds, making sure that his capillary refills in each nails are less than 2 seconds. Also feeling the patient's skin. I would normally do that without gloves, to feel the patient's skin for warmth, and as I can see, there's no mass on the patient's skin. So I'm going to raise your arms. Very good. And I'm going to ask you to bring your arms down and try to put your arms behind you. Both arms up to your shoulders. Very good. I'm going to ask you to cross your arms in front of your body. Very good. And then I'm going to ask you to touch your palms together above your head. Okay. And then move your arms across your body. Very good. And I can see that the patient has full range of motion in his shoulders and full range of motion in the upper extremity, which is a grade 5 as well. For the lower extremities, I'm going to do the same. Inspect first. I'm going to ask you to stick your legs out a bit. Sit back a little bit on the chair. Stick your legs out a bit. I'll look at the skin as well. The skin, there is just slight dryness on the lower extremities. But the patient's complexion is matching his ethnicity. The skin is warm to touch, and there's no tenderness. Is there any tenderness as I squeeze on your legs? Okay, and there's no tenderness. There seems to be no bulging of the knees. Both knees are symmetrical. Both ankles and legs are symmetrical in length. I back down so I can assess your hip. Your head. All right, so just covering back for a little bit more privacy. Your knee and pull it towards your abdomen. Very good. You can put your knee back down. Hold your leg up. I'm going to hold your leg up in a straight leg. Are you feeling any pain when I do that?
No.
Very good. I'm going to ask you to swing your leg outward for me, towards this way. Very good. And swing it back in. Okay, I'm going to ask you to bend your knee and make like a number 4. Very good. No pain when I'm doing this?
No.
Very good. All right, so I'm going to now assess the patient's knee, and I can see that they're, as I said before, they are symmetrical. There's no bulging in the knees. By squeezing the knees, I can feel that there's no fluid in the knees. Looking at the back of the knee, I can see that there's no bulging, or there is a pocket with fluids behind the knee. As I feel, looking at the patient's legs and feet, I can see that the ankles, there's no swelling. I can see that in the lower extremity of the foot, there's no swelling. I can see that the toes are warm to touch. There's no cyanosis that can be seen in the lower extremities. There's no redness also that can be seen. Point your toes towards the ceiling. Bend your toes towards the floor. Very good, and the patient has good range of motion. Sit up for me. So now I'm going to be looking at the patient's back, and I'm going to be assessing the patient's spinal area, and I'm just going to be asking you to hold your head up in a straight manner. So I'm assessing the patient's neck and palpating in the back, in the cervical area, around the muscles. There's no tenderness. I'm checking for alignment. I'm going to lift the patient's clothing to look at the back, check for the alignment in the thoracic area, the lumbar area, and as I come down, I'm moving all the way down to the sacral area, and I can see that the patient's spine is fully aligned. There's no bulging of the spine, or there's no abnormal curvature of the spine. I'm going to ask you to stand and perform a couple tests for me. So just stand right here. Okay, so I'll stand on this side just to help hold you so you don't fall. Bend forward and touch your toes. Okay, very good. Bend backwards. Very good. Bend to the right and to the left. I'm going to ask you to twist your top. Very good. And twist the other way. Very good. Now I'm going to ask you to just walk a little down there as I take a look at how you walk. I'm just assessing your gait, and your gait is steady, and the patient is not swaying while he walks, and he's able to not dragging his feet. He's not limping while he walks. His arms remain at his side, and they're symmetrical as he walks. There's no evidence of pain as the patient walks. And I'm going to ask you to try to walk on your toes. You could try to walk on your toes across. Very good. Okay, and walk back to me on your heels. Very good, very good. So we see that the patient has good balance and good symmetry as he walks. Sit back on the chair. And just a quick question. Can you tell me where you are? You can sit up, you can sit up. Just tell me where you are.
Oh.
Very good. Very good. Do you know what time it is, day or night?
Night. Evening.
Okay. And do you know what I'm doing right now?
Assessment.
Very good. Okay, so the patient is able to clarify information, and he's able to communicate freely, and his speech is fluent. So I'm going to do a quick cranial assessment on the patient, and just cover your nose for me. One nostril, and inhale, and exhale. Very good. Which is showing me that the nostril is not occluded, and I will do that on both sides. I'm going to ask you to just take a quick look at my Snellen chart, and I'm just going to ask you to read this line that I point to.
APTZO.
Okay, and we can see that the patient is able to see, so we're testing his optic nerve, which is testing his visual field. Now I'm going to be testing the patient's cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens nerves. And these are just checking for the patient's pupillary signs, and also doing the 6 cardinal points. So I'm just going to ask you to turn so that we can face the camera. I'm going to just shine the light on your eyes. I'm going to do the same on the opposite side. Okay, and I'm now going to ask you to follow the pen with your eyes in 6 cardinal points. Just do not move your head, just follow with your eyes, okay? Very good. Very good. And we see that the patient's cranial nerve 3, 4, and 6 are intact. There's no nystagmus. The patient's eye is able to keep its gaze. I'm now going to palpate for the patient's trigeminal muscle, which is cranial nerve number 5, and I'm going to ask the patient to just open their mouth and try to clench your teeth tightly. Very good. And there's no clicking in the jawline, and we can see that the cranial nerve's motor sense is intact. I'm going to ask the patient to close your eyes. And I'm going to use an object and touch the patient at different points, and you just let me know when you feel, and where do you feel it. Close your eyes. Okay. Where do you feel it?
The jaw.
Where do you feel it?
Forward. Chin.
Very good. And the patient's cranial nerve number 5 is intact. Just asking the patient to just puff your cheeks out and then lift your eyebrows. And then we can see that the facial nerve is intact. And then also looking at the patient's acoustic nerve, I'm going to be whispering something and asking the patient to repeat what you hear. And the patient is able to repeat what is heard. Okay. For this test, I'm going to ask the patient just to stick its tongue out. Very good. And we can see that the tongue is midline, upon protrusion, and the tongue is not swayed to either side. Muscle testing, I'm going to also ask the patient to do the rapid alternating movements, which I'm going to ask you to place your hands on your knees and move it from back to forth as fast as you can. And his movements are symmetrical and equal. I'm going to also ask you to do the rapid finger movement, which I'm going to ask you to touch your fingers, thumbs, and just move as fast as you can back and forth. Very good. Very good. And we see that the patient is able to maintain coordination. Okay, so now we're going to do the finger to nose test, and I'm going to ask you to touch your nose and then touch my finger, and just in wherever my finger goes. Very good. Again. Very good. And the patient is able to accurately complete the finger to nose test with smooth movements, no tremors in his arms. Now we're going to do the pronator test, which is I'm going to ask you to stretch your arms out in front of you with your palms facing towards the ceiling and just hold it there. Okay, now I ask the patient hold this for a quick 10 seconds, and I'm looking at it. The patient does not have any drifting. Okay, thank you. The patient has no drifting of the arms downwards or no swaying, and which means that there's no deficit. His motions are effortless and without any drifting away. Okay, so now I'm gonna ask you to close your eyes. I'm gonna touch random areas of your body, and you let me know where I'm touching. Where am I touching?
No,
Where am I touching?
like
Where am I touching? Okay, very good. And now I'm gonna do sharp, dull differentiation, and you're gonna let me know if you feel sharp, which is gonna be this feeling, and let me know if you feel dull, which is gonna be this feeling. Okay? So, what do you feel?
sharp,
Very good, which I use the sharp part. What do you feel?
sharp,
Which I did use the sharp part. What do you feel?
dull,
Which I did use the dull part. So the patient is able to feel sharp, dull, sharp or dull sensations and able to differentiate between those. I'm gonna also do the stregnosis test, which I'm gonna ask the patient to keep his eyes closed. Close your eyes. Okay. So let me know how I'm moving your finger, if it's up or down.
down, down,
Okay, very good. So the patient is able to tell proprioception. And now I'm going to test for stregnosis. And in this test is where the patient is able to identify the object that I'm going to place in his hand. I'm going to ask you to close your eyes again, and I'm going to place something in your hand, and then you let me know what it is that is in your hand.
a fork,
Okay, so the patient is able to recognize that I placed the fork in his hand. And graphesthesia, I'm going to still ask the patient to keep your eyes closed, and let me know. I'm going to write something in your hand, and you let me know what I'm writing in your hand.
D,
And I wrote the letter D in his hand. And then I'm going to do to the next side, and you let me know what I wrote.
8,
And I did trace the number 8 in his hand. So the patient is able to recognize that tracings that are made in his hand. So that concludes my full head to toe assessment of the patient. Thank you very much for your assistance. Thank you.